All right, we'll go ahead and get started. Thanks so much, everyone, for being here. We're really excited to have such a large turnout and try this platform that's sort of new to us for a big meeting. So appreciate your patience as we go through it. My name's Sarah Kurz. I'm the Vice President of Communications and Outreach for Rose Community Foundation. And a number of my colleagues are going to be presenting today, so I'll introduce them as we go. Before we get started, I just wanted to do a very quick Zoom meeting orientation in case there's anyone who doesn't sort of spend their life on Zoom these days, like some of us do. So there's a chat window. If you sort of move the mouse over the screen, you should see a bar at the bottom, and there's a big chat button in the middle. So if you open that, you hopefully will see a message from me already. And you can use that window to ask questions. We're muting all the participants for the whole call just because it's such a large group, but would love to hear questions in the chat window, and we're happy to be available for follow-up questions if there's anything we don't get through today. Last Zoom orientation thing is that at the top right corner of your screen, there's a button that says either speaker view or gallery view. It might be easiest if you put it on speaker view since folks are spread out across multiple screens. And that way you can be sure that you're able to see the person who's talking at that moment in time. So if anybody has questions or technical difficulties, feel free to put something in the chat. And then you can also email info@rcfdenver.org if that doesn't work for any reason. We already have a question of whether presentation materials will be shared following the call. We actually are not presenting any slides. We're just going to be speaking, but we are recording this. So we're happy to send out the recording of this to anybody who's interested afterwards. We also did encourage folks to send questions in advance when you RSVP'd. So a number of folks did that, and we really appreciate that. We will address those either as speakers go or at the end when we have a more organized Q&A section. Some of the questions we received were really specific to our future grant making and the sort of ins and outs of what that's going to look like. Those questions we're going to follow up with folks offline for. You should have received an email about that if you sent one already. We just want to remind folks that this briefing is really intended for us as individual donors, whatever level that means for you, to inform our charitable giving and provide context for what the philanthropic landscape looks like around us. So thanks again, everybody, for being here. We're really excited to see so many faces. With that, I'm going to introduce our first speaker, which is Rose Community Foundation's President and CEO, Lindy Eichenbaum-Lint. She's going to discuss the policy and funding landscape around our giving. Thanks, Lindy.
Thanks, Sarah. Good morning, everyone. It is so exciting to see faces that have not been a constant on my computer screen the last 5 weeks. So really happy to see you all. Thank you for taking time out of your schedule to be part of this conversation. One of the most wonderful things about Rose is the community of donors that we get to engage with and work with and be inspired by your philanthropy and generosity. And so since we are spending 24/7 immersed in the ins and outs of the needs and the landscape around COVID-19 and its relationship to philanthropy, we wanted to share what we're learning with you because we know you have questions as you think about your own personal philanthropy. So thank you for joining us. Wanted to start today by setting some context for the funding environment that we all, either as institutional funders, foundations, or as individual donors, are working within. And you can't think about this environment, obviously, without starting at the federal government level. And as you know, the Congress recently passed its most recent stimulus legislation called the CARES Act. We at the foundation advocated to our senators that nonprofits be included alongside small business in access to capital and access to the payroll protection program loans that we've now heard a great deal about. So one positive of the legislation was that the nonprofit sector was included for access to capital. doesn't mean that it's perfect. I think you've probably started to read about small businesses and nonprofits alike that have not been able to access the loans, either because of the complexity of the process for them or the inadequacy of the dollars that were set aside. And we know that Congress is already looking at what the next round of funding will look like, because they're, as large as the dollars were, not surprisingly, it was not enough to address the need and the demand. But in addition to dealing with the nonprofit access to capital, there was also donor provisions in the CARES Act that we think are especially relevant to our donor community. And so the CARES Act, didn't go as far as we would have liked. It did create some charitable giving incentives for donors in the form of a new above-the-line deduction for total qualified charitable contributions of up to $300 per eligible individual. We would have liked that cap to be larger, and who knows, maybe that will get changed in subsequent legislation. But that incentive applies to contributions made in 2020 to be claimed on next year's tax forms. But interestingly, the CARES Act also raised the existing cap on annual contributions for those taxpayers who itemize, from 60% of adjusted gross income to 100%. So that is a notable increase, and may inspire, we hope will inspire additional philanthropy throughout the country and throughout the region. So there's some real positive things about the CARES Act, and then obviously some shortcomings. The funding is limited, definitely a competitive environment for loans, as one would expect. This was the legislation that provided the stimulus checks for people meeting certain criteria. The delays in getting those checks out notwithstanding, we also know that there are people who will not be receiving those checks because of their immigration status. And so there's a real need, and something we've certainly looked at in our own philanthropy, around how do you support those people who don't have access to government benefits at this critical time. So that's the CARES Act, and certainly later on, if you've got additional questions, I know we have folks on our team that are prepared to answer those questions. So moving from the federal level to the state level, you might have heard, hopefully, about the statewide COVID relief fund that the governor stood up about a month ago. So that fund, which sits at Mile High United Way, a lot of foundations and corporations and individuals have supported the fund. Rose made an initial investment of $100,000 in the fund, and it's quite possible we will do more as time goes on. The fund is now up to $12 million, which sounds like a lot of money, but it's really a drop in the bucket compared to what they're seeing in terms of demand. They just finished their first 2-week grant cycle. They were only able to provide dollars, max $25,000 to 22% of the applicants. So they are doing that grant making in kind of 3 categories. The first is prevention, the second is impact, the third is recovery. And they haven't even opened up the recovery yet, because obviously the demand is so great in the first 2 categories. So certainly, if that's an area of interest, a statewide pooled fund, there are links on our website. You can go to Help Colorado Now, but that is kind of a coordinated statewide response with government, philanthropy, and business. On the flip side of the state, it's not surprising, we're so dependent on sales tax for our revenue streams that the state is predicting a massive multi-billion-dollar shortfall for next year's budget. So, we always say that every foundation could pool its entire corpus together, and it would only keep the state running for a few days. So philanthropy tries to strategically fill gaps, but government is really the big player in addressing a lot of the needs that our communities face in good times, let alone in crises. And we are looking at a fiscal juggernaut of epic proportions, and that is going to place even more demands on the nonprofit sector, on the philanthropic sector, and so it is definitely something for all of us to keep in mind and be aware of. Bringing down to the next level of really the philanthropic community, and we have been thrilled to see so much collaboration and coordination among the various foundations of all sizes and geographies within the state. Philanthropy Colorado, which is a membership organization that many of us belong to, has done an excellent job in really helping to take us all on learning journeys related to the issues that are arising, but also help us coordinate and collaborate on our response. So what you're seeing foundations do is absolutely contribute to various pooled funds, like the statewide fund that we mentioned, but there are other pooled funds happening. But all foundations also are doing their own independent strategies that align with their mission and their values and their history. So you're seeing really a combination of both. Philanthropy Colorado did a survey a few weeks ago of the nonprofit sector to understand kind of what the needs are. A lot of these surveys have taken place. Our program officers have certainly spent a lot of time on the phone, on video calls, talking to long-term grantee partners to really build our understanding of the landscape. What you're hearing isn't surprising, right? There's a tension between the needs of nonprofits that are on the front lines of this pandemic. So those are folks who are delivering the medical services. They are working with the populations that are most impacted, either from a health perspective or from an economic perspective by this disruption. They're really the front lines that are seeing the demand for their services change and grow at an unprecedented rate and not necessarily having the resources to support that. And on the other side of the equation, you have pretty much everyone else, because the entire nonprofit sector feels impacted and is impacted. And why is that? Because we're now in stay-at-home orders, and how many of the annual fundraising lunches and dinners that you usually get invited to and you usually attend have been canceled. And so this is impacting revenue streams, obviously, as well as nonprofits that were dependent on revenue streams that were dependent on people, whether it was an early child care center or a speaker series. People can't come. People aren't buying tickets. Arts organizations are obviously being impacted. So, whether you're on the front lines or not, there are impacts. And certainly we all know as donors, a lot of nonprofit organizations were struggling financially before this situation, but the situation has exacerbated the problem. And so there is this tension, I think, for donors, and nonprofits are feeling it too, because in a crisis, we all want to support the emergent need. And there's other folks on the sidelines that are like, but what about us? And so that is why foundations like Rose are looking at a multi-phase, multifaceted response, and we're trying to pace ourselves because we know about the problems today, but there are other things that are going to pop up down the road, and we want to make sure we still have resources at that point to be supportive. So we are happy as we work with donors to share what we're learning about the landscape in certain issue areas that you might be interested in, or more globally. Please think of us as a resource for that information to the extent that it helps to inform your personal giving. So I want to close my portion by focusing on what Rose Community Foundation is doing, so you have that visibility. First of all, one of the things that you're hearing sector-wide is nonprofits are clamoring for flexibility. If they have existing grants that were very specific and very restricted, they're hoping that funders and donors will release them from those restrictions. In many cases, they can't deliver. Case in point, Together We Count is the census outreach organization that we fiscally sponsor. They received a lot of grants about convenings they were supposed to be hosting, in-person outreach. That can't happen. It's not their fault. So they need to shift how they use those dollars, and they've been seeking flexibility from their donors in order to do so, and it makes sense. So a lot of shifting of restricted grants to general operating, a lot of extensions on deadlines or reporting, really trying to remove some of the burdens and increase the flexibility at this time. And in many cases, those are dollars that were already out the door. And so that's something to think about if you as donors have some highly restricted donations that are already sitting out there. Think about revisiting if you're comfortable and willing to let the organization know that it's okay to reallocate the money to where it's needed most in this current time. As far as new dollars out our door, so I think you all know we're at a very interesting moment at the foundation where we are in between the old and the new. So last year we spent the year doing a comprehensive strategic plan. We unveiled it in January. Many of you were there for the unveiling, and we are so excited about it. We had intended to use this year transitioning to the new plan, and by the end of the year, stand up all of this new frameworks and grant making. And the reality is the universe had different plans. And so as horrible as this pandemic is at the micro and macro level, and we would never wish it on any species or planet, if something like this were to happen, it is the best possible moment for Rose Community Foundation's response. Because we were in between the old and the new, we are able to be more responsive, more flexible, and more nimble than we might have been otherwise. And while a lot of the implementation of our strategic plan is now delayed, we are actually leaning in and using the strategic plan to inform our new grant making. Everything from being community informed and nimble and responsive, to letting our values lead our grant making decisions, to putting equity front and center in how we organize our grant making. So we feel really good to be informed by this strategic plan. But basically, our grant making for 2020 falls into two categories. The first, in Q1, actually literally days before COVID-19 became a thing, we mailed out $2.6 million in unsolicited, unrestricted checks to our grantees. And these were intended to be a transition to mitigate the impacts of our evolution on them to longstanding grantees. But the timing honestly couldn't have been better for them given what was to come. The second category of grant making is really COVID-19 response. And our board has been incredible and has authorized us to allocate all of our remaining grant making dollars for 2020 that were not previously committed. All are going to a multi-phase, multifaceted COVID response. And so that is tremendous. We've already granted out $1.2 million just in the past 2 weeks. And we have at least $4.2 million remaining for the rest of the year. That is our dollars. That does not include the activity that our donor advised funds are doing, and Sarah and Dick will talk more about that later. But I emphasize this to let you know we are in this. We are leaning in with all of our resources, financial and human. We don't know what the time horizons are. We don't know what the full scope of needs are. There are going to be ripple effects that we have not even contemplated yet, that evolve from this situation, and we want to be there in places that our community needs us most, and we want to help you all as donors be there too, where it works for you. Additional steps we've taken to support our grantees is additional flexibility for our endowment funds. And some of you on this call, I believe, are associated with organizations that have endowments with us. So we have extended the deadline for our endowment fund holders to take their 2019 distribution. We also, for the organizations that are part of our Live On Life and Legacy cohort, and those are Jewish organizations, we are expediting their incentive grants for those that have already met their fundraising goals. So we are trying to get money out the door as fast as possible for places it's needed most. Certainly, we want to be there for our donors as well. We know you are all feeling this very, very deeply, and you all want to help, and we want to be a support and resource to you. We have been awed and inspired by the incredible response we've already seen from our donors in response to the COVID crisis. We are continuing to update the resource page on our website that has a growing list of organizations in different categories that may be of interest to you, organizations we are talking to and vetting, and in many cases have given grants to ourselves. And of course, we encourage you to reach out to our philanthropic services team directly if you're looking for guidance to support your philanthropy. And so I'm just going to close with making sure you're aware that we have, like many organizations, stood up our own COVID-19 response fund. Unlike a lot of organizations, a lot of community foundations around the state have to do these funds in order to give out money. And Rose is in a place of privilege that we have our own corpus. And so the millions of dollars I talked about earlier are coming from that. We don't have to fundraise to do that. But we also know that there are donors and there are other private foundations that would like to align their dollars with our strategy and approach. And so we wanted to create an opportunity for them because they were asking for it, quite frankly. This is an example of the market speaking for itself. So our board approved, authorized us to stand up our own COVID response fund. And in 2 weeks, it is already exceeding $530,000. So we certainly encourage you to give directly to nonprofits, and we want to help you do that. But if you like what you hear about our approach and think that aligning your dollars with what we're doing and expanding our impact is of value to you, the COVID Respond Fund at Rose is absolutely an option for you as well. And certainly we're able to answer additional questions about that later on. So I think that is it for me. For now, I'm going to turn it back to Sarah Kurz. Thank you all.
Thanks, Lindy. That was great. And we have 92 folks on the line right now, which is really an inspiring testament to how interested folks are in trying to be charitable at this difficult time. And so we're just really excited to have everybody with us today. Lindy, we received one question in the chat that I thought you might want to handle, and then Benny can also speak to how we've addressed this in our own grant making. The question came from Marjorie Goldman asking, does the statewide fund address the needs of our undocumented population? And I'll just take the moment to remind folks that the chat window is open if you have additional questions.
Thanks for that question, Marjorie. Yes, it does. Organizations, the statewide fund does not give dollars to individuals, but yes, organizations that are serving undocumented populations are absolutely able to apply. The first round of grants from the statewide fund was announced yesterday. You can see the list on Help Colorado now, and I think you will absolutely see some of those organizations. The statewide fund is not government dollars. So it's dollars coming from foundations, individuals, and corporations. So that does provide additional flexibility. And as Sarah said, you'll hear more from Benny about what we're doing, because that is obviously a population of interest for us as well.
Yeah. So with that, I'll introduce our brand new Vice President of Programs. She started only a few weeks ago and started in this very weird remote world. So I'm excited to introduce you guys to Benny Samuels, VP of Programs, who's going to walk through the needs that we're seeing in the community and how we've responded so far with our own grant making. Thanks.
Thank you, Sarah, and good morning to all. Yes, an interesting start to a new job, but grateful to be joining this team in this pivot. You know, I'll say that at the end of March, the board, and Lindy, I think, had mentioned this, had committed to devote the entirety of our remaining 2020 grant-making dollars to the impacts of COVID-19 in our community. And so that decision has been made, and therefore our entire programmatic work has pivoted to work on that and to respond on that. We are organizing our grant making into 3 phases following the lead of the state, which Lindy mentioned. The first phase we think of as prevention, containment, and emergency response. So these were grants directed to nonprofit organizations and government agencies on the front lines of the COVID pandemic response. And they are specifically aimed at supporting the greater Denver's region's most vulnerable and impacted populations. So in April, we did our first round, and let me tell you a little bit about when we say the most vulnerable and disproportionately impacted populations that were included in our grant making in the first round include the domestically at risk. Now we're at home more, and for some, that's not the safest place to be. The food insecure, that has really been probably the #1 issue out there, right? I mean, there are thousands, hundreds of thousands of children now not in school who were getting their some of their meals at school. Individuals who were working and able to buy their groceries, now they cannot do that. The homeless and housing insecure who were already in a very challenging position. This has exacerbated that position. Immigrants of all status. So to answer the earlier question, our own Rose Community Foundation funding does include funds to support immigrants of a variety of status. And in addition to those who work and cannot still access federal unemployment and those benefits. As always, the Jewish community has been receiving support in response to this, and my colleague Vanessa will speak more to that. The medically vulnerable, right? I mean, this can affect all of us, but there are some of us who already came with medical vulnerabilities and are at a higher risk. Older adults, of course, are part of that. And then remote learners. Our first phase really focused on remote learners because there's a new reality for learning, not just for the kids, but for the families that have to support those kids. And we wanted to make sure that kids had the tools that they needed to continue to learn as best as they could while they were at home. That includes Wi-Fi, modems, computers, right? That we know don't necessarily exist in all homes. And so that is a briefing of the first round, the prevention, containment, and emergency response. We do not know and do not really think this is the end of this. We may be doing more grants that are in response to this particular category. As Lindy said, we are already hearing some of the ripple effects that this is having on our communities, and we're really keeping an eye and our ear open to what those are. I think we've all read about the spike in mental health calls to mental health lines. We have concern about what this does to well check visits that were already scheduled and maybe falling by the wayside. So there are things that are going to go to the back burner that are going to cause other challenges. And so we are keeping an eye out for that, and our impact mitigation round, whenever that is going to address that. Of course, this is all done in conjunction with our other peer funders and in our communities. And then last but not least, we are anticipating to have a recovery phase to our grant making, right? Our nonprofit partners have been tremendously impacted. Pretty much everybody's fundraising activities and plans have been either canceled, postponed, or are completely flipped on their head. So thinking about that gap and what will it mean for the operation of that nonprofit, and in turn, what does it mean for the people that depend on those nonprofits for their livelihoods, for their food, for their services. And so those are the three areas, and this is such a ever-changing situation. It's hard. We get this question a lot: when will round 2 happen? When will round 3 happen? And it's very, very hard to know. What we can tell you is that we are on the phone and in connections with our nonprofit partners on a regular basis, so trying to keep really abreast of what the needs are, and making decisions about when and what based on those needs.
Thanks so much, Benny. Next up, we're going to hear, as Benny mentioned, from Vanessa Bernier, who is our program officer for Jewish Life, and she's going to speak more about what we've seen and the impacts on that community and how we're responding.
Thank you, Sarah. Good morning, everyone. So I will talk a little bit about the phased approach for the Jewish Life community and program area, and just want to say how proud I am to be a part of an organization that has been so informed by community in the approach and in the response to COVID. So we in Jewish Life created 3 lenses to look at our grant making based on what we were hearing from our partners on the ground and what we were hearing from our colleagues in the field, and some of what we weren't hearing. So we developed some lenses in partnership with the Jewish Life Committee, and the first lens of that is supporting Jewish organizations on the front lines in prevention and containment, much like the broader work of the foundation, much like the Governor's Fund. The first line of defense there is really around prevention and containment. So in the Jewish Life portfolio, those are just a few organizations, but it's really ensuring that those who provide direct support to populations most vulnerable to or impacted by the medical and economic impacts are being tended to. So we've gotten those grants out the door. That was based on conversations. There was no application process. We've moved forward with that. And as we look at what's coming next in the days and weeks ahead, we know that there are some additional lenses to look at. And so while the mitigation is the second lens for the broader foundation, in Jewish Life, it requires a nuanced and slightly different approach in thinking about how do we sustain and nurture Jewish life in times of physical isolation. So we're thinking about that and in those conversations, and we don't know what that looks like yet, but our partners in the field certainly do, and we are listening to those conversations and working to understand what that'll mean. And as we get further down the road, we'll certainly be looking at ways to help mitigate the long-term economic disruption. And as Lindy said, there are ways that we've been able to use the lenses of our strategic plan that we spent last year doing. And one of the ways we'll be able to do that in Jewish Life is, as we think about mitigating the bigger economic disruption, how do we at the same time strengthen our Jewish organizations and build their capacity and resilience? So those are the ways that we're looking at our grant making going forward. So to date, our grant making has supported Jewish Family Service, who's seen a 200% increase in demand for their food pantry, along with increased demand for mental health services and just about everything they do. They're feeling the pressure. Kavod Senior Living set up a fund for their residents to have access to pantry food and the basic non-perishable goods and toiletries that they may not have been able to access otherwise. And then the third is Shalom Park, who's needed to implement hazard pay for the staff that are coming to work every day, the housekeeping, the nurses, the physicians, as they have longer days and more hours and more demand for the medical professionals. So that's where our work has been thus far, and we'll continue to look at opportunities to support the community in new and different ways and listen to those needs and really turn an eye toward strengthening the community as we go forward.
Thanks, Vanessa. Last speaker before we have time for question and answers is Sarah Indick, our VP of Philanthropic Services, who's going to speak to what we're seeing from our donors and how we can support you moving forward.
Thanks, Sarah. It's so wonderful to see all your faces. I know we're supposed to be doing speaker view, but I have you in gallery view because it's just good to see you all. I want to start with an expression of deep gratitude to our donor advised fund holders and to everyone who is stepping up in their giving right now in inspiring ways. In the past month alone, 41 of our donor advised funds have made 124 grants, totaling more than $750,000. This represents a 340% increase over the dollars typically granted this time of year. About 60% of those dollars are going to organizations on the front lines of responding to this crisis. Many of those grants are focused on things like food access, basic needs support, and medical response efforts. About 40% of these dollars have been grants providing ongoing support to longstanding donor advised fund grantees, as we've seen some donors accelerate their annual giving to organizations that may not be directly responding to the COVID crisis, but that are nonetheless negatively impacted by the current economic disruption. Our team in Philanthropic Services, all of whom are on this call, and some of you have your videos on, you can wave if you are. We are all here working to support donor grant making. Community foundations are made for situations like this one. We see ourselves as part of a community of givers, along with all of you, and we're working to understand the landscape of nonprofit response efforts and community needs, and to be able to share that information with people who are in a position to give. On this call today, we're speaking to all of you as donors and partners in philanthropy, whether you have a fund with Rose Community Foundation or not. We recognize that we all wear many hats in our communal and personal and professional lives, and this is an all hands on deck situation where any of us who are in a secure enough financial position to be able to help have the opportunity to step up in our giving, knowing that the needs have never been greater in most of our lifetimes. So here are a couple of considerations for your giving. First, think about responding with a long time horizon. We have been repeatedly reminding ourselves over the past few weeks that this is a marathon and not a sprint. And I think it actually turns out that it's an ultra marathon. And we all started running, not knowing how long the road would be or how many twists and turns it would take, and we still don't know. So this is a situation that asks givers to listen, to be flexible and responsive, and to make decisions with incomplete information. There isn't a roadmap here. But one thing we do know is that many of the causes and people and communities that depend on your philanthropic support will need you for the long haul. You may want to think about your giving as having multiple phases, even though those phases are not likely to be discrete or linear. Right now, for many, the focus is and should be on emergency response. So addressing immediate basic human needs created or exacerbated by this crisis. This includes things like food access, medical support, housing, and also direct financial assistance. Our website includes a page listing a broad range of local giving opportunities, and we've also published a list of all of those first round emergency response grantees that Lindy and Benny talked about. Links to both are in the chat window. Thank you, Katie. And we would love for you to consider joining us in supporting some of these efforts. Another phase or consideration in our philanthropic response, all of our philanthropic response, is nonprofit sustainability. So regardless of whether a nonprofit is on the front lines or not, data from the Nonprofit Finance Fund suggests that about half of nonprofits have enough cash on hand to cover 3 months of operations. And a quarter or fewer have the reserves to cover operations for more than 6 months. You pair that with the reality that Lindy discussed of significant revenue losses from what will be months of canceled events and lost program services fees and an inability to charge for or deliver programs, charge for tickets. And we can anticipate a major and lasting impact on the nonprofit sector as a whole. The needs and the timing of those needs, though, will vary depending on the organization size and type that you're considering supporting. So let's talk for a second about recovery, and then we'll come back to the present. No one has a crystal ball here, but I think we can anticipate down the road needs related to job training and workforce reentry. Ultimately, a resurging demand for childcare as people are able to return to work. And I think we can also expect to see that we will need to address exacerbated inequities in areas like health and education attainment, as communities most affected by this crisis will have farther to come in recovering from it. So another consideration for all of us to think about in our philanthropic response is how to potentially focus your giving through a particular lens. And this can be really helpful when the scope and the scale of the issue is so vast that it's hard to know where to begin. So what can this look like? If you have a commitment to a particular cause or population already, it's helpful to start by understanding how this crisis is affecting that issue or group and to focus your attention on addressing those needs. We can help you explore giving opportunities at that intersection. If you already tend to approach your philanthropy with a focus on basic human needs, then focusing on responding to those immediate needs in the short term is a great place to start. If you tend to focus more on longer term solutions, then you might want to think about giving to medical research efforts to advance testing and treatment. And finally, as you heard from Benny, Rose Community Foundation's strategy is a multi-phased one, focused on supporting organizations, serving people and communities who were farthest from opportunity before this crisis hit, and who are experiencing a disproportionate impact from it. If this approach resonates for you, we welcome you to join us in partnership through our COVID-19 Respond Fund. The needs are great and growing, but so too are the stories of people who are stepping up to help. Some of our donor advised fund holders have been generous enough to share stories with us about their approaches to giving at this time. And we're featuring those and adding to them every week on our blog, on our website. So if you are ever in need of some inspiration or good news, I encourage you to visit and check them out. And I just will end by saying that the path forward is not clear for any of us, but we still can proverbially link arms from a safe social distance and walk forward together in support of our community and one another. And we really appreciate you spending part of your day here with us. I'm going to hand it back to my fellow Sarah, because we have saved the rest of this time for your questions.
Thanks so much, Sarah. And we are under no obligation to go until 10:30 if folks don't have more questions, but we are really excited to be able to answer them. So please use the chat window. In the meantime, I'm going to focus on some questions that we received ahead of time. And if you sent a question ahead of time and you don't feel like it was answered, feel free to put it in the chat again. One question we received was, what have historical trends looked like for philanthropy recessions? Although we're at a time without a lot of contemporary analogous situations, are there models in the past that we can draw from? So Sarah or Lindy, would you like to be the first to respond to that one, or anyone else on your team?
Lindy, you want to go ahead?
I don't know. I mean, this is really uncharted territory. When I think about the crises in my own lifetime, a lot of them revolve around natural disasters, and they are a lot more finite. You know, there is a limited time horizon for the infliction of damage, and the impacts are much more tangible. You know that buildings and roads and infrastructure have been destroyed, and success looks like they've been rebuilt. And this is very different. Benny alluded to the disruption of well check. So that's an interesting conversation we had with Denver Health, who are encouraging their pediatric patients, understandably, like, don't bring your kids for well checks to the clinics right now because they would be potentially exposed to greater risk. Totally makes sense. But what that's also doing, and they know this, is it's disrupting vaccination schedules. So 6 months, a year from now, there could be an outbreak related to preventable diseases because of the disruption in vaccine schedules. That is just one example of an unintended consequence, ripple effect, that we don't have visibility to yet. So that's why this is so different. Obviously 9/11 comes to mind in terms of potential parallels. You had a temporary shutdown in travel, and a lot of unknowns in terms of safety. But even that has a lot of stark differences to what we're seeing here. And I mean, this is the first time, I believe, in our country's history where every single state has issued an emergency declaration at the same time. And so we are used to a Hurricane Katrina crisis at the Gulf Coast or hurricane crisis in Puerto Rico. But for every single state at the same time, and it's not just the United States, it is every single country. And so that's why it's really hard to draw historic comparisons to inform our philanthropy or help us predict what the future path looks like.
Thanks, Lindy.
So I agree. I don't think that we have an analogous situation. In 2008, we saw that individual giving went down, right, when we were in an economic crisis. So I think we should expect to see that here as well, which means that resources that already are devoted to philanthropic good absolutely should be deployed to the greatest extent possible at this time. And those of us who continue to be in a position to be able to give should absolutely embrace that and do so. I think, the other analogy maybe is when you're dealing with an incredibly complex challenge in any sector, collaboration is essential, creativity is essential, finding new paths and new ways of solving problems that you may not have seen before because you may not have needed to see them before. And communication and really being in close touch with those who can be your partners. I think those are all practices that we have an opportunity to really lean in on and develop in this time.
I think to that point, Sarah, I'm glad you raised it. I think one positive trend we have seen and opportunities that we continue to seek out are solutions that have a double impact. So they're addressing a community need, but in order to do that, they're utilizing the small business community and people whose employment has been disrupted to be part of the solution. So there's two examples that come to mind. One is the Colorado restaurant response. The other is feeding the front lines. They're both a similar model in that they're raising money and they are using it to pay restaurants and their employees to generate meals. Colorado Restaurant Response is delivering those meals to food insecure families and individuals, the economically displaced. And Feeding the Front Lines is using that to deliver meals to first responders, frontline healthcare workers. And so in both cases, great end result, and helping to boost our economy and our small business sector and rehire employees who would have been otherwise unemployed. So we're seeing there's a new effort underway. PPE, personal protective equipment, is obviously in high demand. And so utilizing locally based businesses that are shut down right now to create some of that PPE. So a lot of creativity and a lot of collaboration is evolving out of necessity. And I think that's a really interesting place for a lot of us as donors to pay attention to.
Great, thank you guys. Another question we received ahead of time from Patrick Donovan was, how are other funders balancing the immediate or basic needs demands and the longer term strategic objectives? So Lindy, you spoke to why this is sort of a fortuitous moment for Rose, in that fewer of our dollars were obligated in grant making than they typically would be. And that's not the case for most of our peer funders. So if you could speak a little bit to what you are seeing from our peers and how they balance that, that'd be great.
So we're seeing a few different things. One, even though every foundation's endowment corpus has been impacted by the market volatility, we are not seeing people scale back on their grant making. We are seeing them either maintain the status quo or in most cases go over their anticipated budget allocations for grant making this year. So that's one important trend that we're seeing. Two, we are seeing others, flex their dollars and reallocate towards COVID. And now I've lost track of where my train of thought was going. The first dollars are always the easiest in any crisis, right? The emergency response dollars come in as they should and as they need to be. And what comes in is never enough. That being said, this is longer term. As Sarah Indick beautifully said, it is a ultra marathon, not a sprint. And so I think we all are worried that a few months from now, there's going to be even bigger needs and the dollars aren't going to be there from the donor community. And so how do we keep the interest alive, and how do we as foundations pace ourselves? Because there's certainly clamoring in the community, like, we need all your dollars right now. And if we do that, we will have nothing left in the months to come. And this is a longer term play. So we're trying to pace ourselves. And I think individual donors should as well. If you give everything now, there's certainly a need for it, and not discouraging it. But we also need to think down the road, because the needs aren't going away, which again makes this a really unique situation, because it is a much more unpredictable and longer and uncertain time horizon than we in philanthropy are used to confronting. So it's pacing, it's not scaling back, even in this time of economic volatility, it's kind of doubling down where we all can as individuals and organizations. And leverage. None of us can do this by ourselves. No foundation, no individual donor. So seeking those pooled opportunities or aligned opportunities where we can really leverage each other's investment.
Thanks, Lindy. I think the pacing and leverage point is really an important one for us all to keep in mind right now. Another question we received in advance from Marjorie Goldman, I'm going to have Benny answer, related to equity and how equity exists in our system already and how it gets exacerbated when there's a crisis like this. So the question is, how is Rose balancing a response to the need for direct services, food, potential loss of homes, mental health services, etc., with the need for the structural change that has created the disproportionate effect of this virus on people of color?
Yeah, excellent question, and and that is the work ahead. I know that immediately we are focusing on supporting the basic needs of those most disproportionately affected. So that in itself is trying to reach those who are already challenged, are not in a same equitable position. But the conversation about how we got here is an interesting one. I was on a webinar last night hosted by the Center for African American Health, and I think you've all sort of heard the headlines. African Americans and Hispanics are not only getting infected at higher rates, but if they get infected, they're also dying at higher rates. And there's a whole sets of reasons for that. However, what was clear on the call is that we've known these disparities have existed all along, right? Health disparities in these communities are historical and have been there. What this has done is really sort of shine a light on it and made it harder for us to completely walk away from it. And so, as you know, from the strategic plan work that the team has done in the last 2 years, this is exactly the focus of our strategic work moving forward. So in the immediate, we're trying to respond to it by making sure that those that are most disproportionately affected are receiving benefits from our funds and from the nonprofits that are serving them. In the not so distant future, our focus will turn to this bigger issue of inequality based on historical context, based on socioeconomic context, and that will definitely be the focus of our work in 2021 and moving forward. And in some ways, it's good that now it's sort of in our face and we can't completely ignore it because we will all be called to do something to respond to it on a permanent basis. And so we will continue. Our entire program team was at that webinar last night. We learned a great deal, including very compelling data that you will be surprised to hear we are just now collecting. Within the last 10 years, we didn't collect healthcare data on people of color as we should be. So we will stay close to that particular issue of healthcare disparities as a result, not as a result, in exacerbated by this issue, and certainly our work will turn to that in the year to come.
Thanks very much, Benny. The other questions we received in advance, as I mentioned at the beginning, many of them were specific to what the future of our grant making might look like as it relates to one organization or another. And Benny and her team are going to follow up individually with those questions. And if you have other questions like that, please feel free to reach out anytime. We really are interested in understanding what the needs are in the nonprofit community and the community each of our nonprofits serve. So please reach out with those questions offline. Are there any other questions that folks would like to raise today? I don't see any more in the chat window, but we are always, oh, we just received one, great, from Miranda. Is childcare a factor that Rose is taking into consideration? Benny, would you like to take that one?
Absolutely. Right. We know from data and just from experience in this field and this work that that parents, and we know this from our own lives, parents cannot really do what they need to do if they don't have the right childcare support system. So some of our recent grant in April addresses childcare support, and that is something that is part of the package. Really, you cannot address other family issues, other inequities issues, other workforce issues without addressing childcare. It's just it's part of the package.
Thanks, Benny. Feel free to send more questions if you have them, but I'll do some just quick wrap up. So as I said at the beginning, we are recording this. So if there's more that you want to listen to again, or you know folks who missed it who'd be interested, let us know. We're happy to share that recording. Sarah mentioned a number of the resources that we have on our website. We are happy to add more. We're happy to direct you to them if you have any trouble finding them. So just let us know, but it should be hopefully a useful tool to inform your giving as we're trying to aggregate what we're learning there. We'll send a brief survey to everybody who participated because this is the first time we've done a big webinar like this. We'd love to hear from you what worked, what didn't, what you'd like to hear more of in the future, if this is a useful platform for you. And just want to close by saying that we are here to support your charitable giving. A huge part of our mission is to foster philanthropy in our community, and we, as Lindy said, can't do that alone. And we're so privileged to be able to work with all of you in doing that in our community. Lindy, do you have any closing remarks you'd like to say?
I just want to thank you all for spending your Friday morning with us. I don't know about you, but I'm losing track of time. The distinctions between work and home and day and night and weekday and weekend have been eroded. And so it is truly opportunities like this to see new faces and to engage that are kind of the milestones that I'm now marking the passage of time with. So this has truly been, I think, speaking for all of my colleagues on the call, a true highlight of the past 5 weeks of our new world of remote operations, to be here with all of you. This month, later this month, marks the 25th anniversary of Rose Community Foundation. And I know some of you have been affiliated with the foundation from the very beginning, and were affiliated with Rose Medical Center before that. And so we salute you for being on this general marathon with us. And we think it is an interesting time for us to celebrate an anniversary that is rooted in a history of health, a commitment to health for all in the community, and really an equity lens before that was a familiar term. And so the convergence of our anniversary with this pandemic is really an interesting and thought-provoking one, but a reminder that we are privileged, as Sarah just said, to have these resources and have this platform as individuals and as a collective to respond and on behalf of our community in support of our community. So thank you. Thank you all for being our partners, our supporters, our ambassadors. Thank you for everything you do on behalf of the organizations you represent. and that you support. The word community in our name, Rose Community Foundation, is not by accident. And looking at this screen today, this is community. And so thank you for letting us be a part of it, and thank you for being on this journey with us, really and truly.
Absolutely. Thanks, everyone. We really appreciate you joining us. We hope you have a good rest of your Friday and a good weekend, and wish you all health. Bye. I'm going to end the meeting. Thanks, everyone.